Welcome back to continue our discussion talking about kidney disease. I'm at the University of Oklahoma, Physicians in Tulsa, or we call it OU Physicians in Tulsa. And joining me again is Dr. Charles Foulks, the chairman of the Department of Internal Medicine. Let's jump in. Our first segment, you did an excellent job letting us know what the kidney does do, its role, its function, and also some of the things we know or think we know about drinking so much water, it's for my kidney, to really clarify that, and vitamins in those. I do want to come back with foods because you talked about foods in general in terms of eating a healthy, balanced diet, that type of thing. Are there certain foods that we know we should stay away from, or are there certain food ingredients that are really good for that kidney to try to keep it normal?
Okay. When you look at foods and the kidney's ability to tolerate it, if you have normal kidney function, you can eat whatever you want. The kidneys will be fine. We were born with more renal function or more kidney function than we really need. However, we do believe that certain foods are good for you. Increased intake of fish in the diet, increased intake of omega fatty acids in the diet. Okay. We have some pretty good studies out there that show that these are helpful, not only to your general vasculature in your heart, but probably also helpful to the kidney as well. Again, it's getting into the favorable omega fatty acids and getting away from the fats that are contained in the usual beef and pork choices that we typically use for meat in this country.
Okay, and you did mention too about that vitamin D. It's important to take that 800 to 1200 international units a day as a supplement.
That is correct.
Let me ask you about a vitamin supplement for the omega fatty acids. Are vitamin supplementations as good as eating the fish?
Yes, actually they are, and we have quite a number of people in the country who are not seafood eaters. Or who are unfortunately allergic to seafood. And with those people, we would recommend that you would use fish oil. And taking 3 grams a day of fish oil is as good as having a diet high in seafood. So if you don't like seafood or you can't tolerate it, then I would recommend that you take fish oil instead.
Okay, now I want to switch here and sort of break down those 5 things that you were saying in our first segment that you can do to keep your kidneys healthy in terms of not being overweight, for instance. Let's start with that one and we'll roll back into looking at diabetes, hypertension. People may wonder, okay, obesity then. What does that do to the kidney? I mean, we were saying control your weight in relation to kidney function. I mean, explain.
Well, it has actually several deleterious effects on the kidneys. One of them is the fact that you have the increase in the body mass. And that's not all just fat. 1/3 of that is actually metabolically active tissue. And that's tissue that's turning over and creating waste products. So because you have this increase in metabolically active tissue, what you've done is you've added an extra burden on the kidneys that they have to deal with. It's sort of like taking a car that has a 4-cylinder engine in it and taking that engine and now let's suddenly put it in a big Cadillac. That's not going to work so well. The demand is greater than the capacity. You begin to wear things out. You also have problems with elevated lipid levels or elevated cholesterol. We know that this is a direct damager of kidneys. It causes increased blood pressure. This is a direct damager of kidneys. You can get diabetes. Again, the same thing. Even in quote, a pre-diabetic state with a so-called metabolic vascular syndrome, you have increased products of metabolism that are causing deleterious effects to the kidneys. When you have to have all this increased blood flow through the kidneys, you've got increased pressure through there. You increase the pressure through anything, you're just simply going to wear it out quickly. Okay,
now when you talk to you about cholesterol, let's move into that then. There are different types of cholesterol. There's the good cholesterol and the bad cholesterol, and I always remember the good by calling it the happy cholesterol, the HDL, and the bad, the LDL, being the lousy. That's how I can remember the two.
That's a wonderful way to do it.
Right, so I want to be happy, not lousy. Now, in relation to that, how do we get more of the happy cholesterol versus the lousy?
Really, the best thing to do for the happy cholesterol, there are 2 things I know for sure that work. One of them is to have chosen the correct parents. I don't know about you, but I didn't have a lot of choice in mine. That's how it goes.
Didn't take my vote beforehand.
No, I agree. The second one is really to make sure that you get in good aerobic exercise on a weekly basis, and that's a minimum of 30 minutes of good heavy exercise a week, and that's heavy exercise where you work up a sweat. That will really help you a great deal in increasing it. We can see an increase in the happy cholesterol, the HDL, if you have the intake of about a 3.5 ounce serving of red wine in the evening. And that works as well. However, if you're a non-drinker, I would not necessarily recommend that you begin drinking just for that. If there are difficulties with alcohol, we definitely would not recommend that as a treatment for it. Foods that are rich in substances that will make your HDL go up, you can look at some of the fresh foods such as grapes, grape juice, those sorts of things will help as well.
Now, does it matter in terms of people may say, oh, grapes, I love grapes. The dark grapes versus the green grapes, is there a difference or?
Doesn't really seem to be a difference. If you're going to use grapes, just remember that they're very, very high in calories. So be a little careful with the eating of the grapes. It seems like most anything we want you to do that's good, a little bit of it's good, a little bit more is not necessarily good. It can get you into trouble.
Okay, now there is grape seed extract in terms of vitamin supplementations, etc. Is that just as good if we're trying to watch those calories?
I would not recommend that you do that. We're not really sure that the grapeseed extract has the same effect. Plus, you have to be very careful of the manufacturer of the grapeseed extract, of knowing what is really in there. So, would not recommend that one.
Okay, excellent. Now, talk to me a little bit about, you'd mentioned about diabetes.
Yes.
And how is diabetes, because many people may say, well, you know, I know how it affects the pancreas and the insulin, that whole 9 yards, but now you've been alluding to diabetes and its effect on the kidney. Clarify that a little bit more.
Well, what happens with the increased blood glucose with you is that increases blood flow through the kidneys by itself.
Okay.
That increases the metabolic work in the kidney. Because of that metabolic work, oxygen is consumed. And then as the oxygen is consumed, it causes the production of some chemicals we call oxygen-free radicals. An oxygen-free radical is a chemical that has a negative charge on it, and it is very damaging to the kidneys. Think of it as taking hydrogen peroxide and pouring it on a blood stain and watching it bubble as it gets rid of the blood. Well, the oxygen-free radicals are doing that to your kidneys.
Oh my goodness.
Kind of like pouring peroxide in there. So you don't want to do that. So you really need to keep that blood sugar down, and we recommend totally normal blood sugars. Normal blood sugars.
Okay, now what should that look like for an adult?
Under 120 at all times.
Okay, and some people may say, wow.
Yeah, that's called strict control. But we know that if you practice strict control, that we can preserve kidney function in you. Those data are very clear. And so the oxygen-free radicals is one way it works. Also the fact that you have the increase in the blood sugar that increases the blood flow through the kidneys, you're increasing the pressure in the kidneys. As you're increasing the pressure, you're causing the arteries in the kidneys to expand. When they expand, they cause the supporting cells around them to create chemicals that are very damaging to the kidneys as well, and they cause scarring to occur from these chemicals. So there are a variety of ways that diabetes is very, very bad for your kidneys.
Okay, and then with our hypertension, really quickly before we take a break, of course, that is affecting us.
Yes, the kidney is very sensitive to the effects of high blood pressure. As you increase the pressure through the kidney, what happens is the arteries will try to relax as a response to that, but they get the damage from the pressure head, and so what happens is even though they try to relax, you get the buildup of the interior lining of the blood vessels, and so it begins to close off and begins to slowly starve the kidney. The way I explain this to my patients is, if you want to know what high blood pressure is doing to your kidneys, go get a piece of liver, a piece of beef liver, and let's get ready to have liver, and let's get your meat hammer out, and let's beat the liver down before you fry it. That meat hammer is the blood pressure, and the liver is your kidney, because that's what you're doing. You might as well take a meat hammer to your kidneys if you don't get your blood pressure controlled.
Okay, we're going to
take it's really that simple.
Yeah, and it's that dangerous.
It is.
We will take another quick break and come back and focus on chronic kidney disease.
Good.
Okay. Please stay with us. We'll be right back.